Attention deficit hyperactive disorder and traumatic brain injury. A recent Canadian study has found a significant association between adults who have suffered a traumatic brain injury at some point in their lives and who also have attention deficit hyperactive disorder, suggesting that adults with a history of brain injuries may benefit from improved screening for the behavioral disorder. Published in the Journal of Psychiatric Research on August 7, 2015 by Dr. Gabriella Illy, Division of Neurosurgery, St. Michael Hospital, Toronto, Canada. The data used in the study was collected by the Centre for Addiction and Mental Health's Monitor, from a cross-sectional survey of almost 4,000 Ontario residents age 18 and older. Traumatic brain injury is described as any injury to the head that resulted in loss of consciousness for at least 5 minutes or overnight hospitalization. Attention deficit hyperactive disorder, measured by self-reported history of an ADHD diagnosis or the Adult Attention Deficit Hyperactive Disorder Self-Report Scale known as the ASRS. Among adults with a history of traumatic brain injury, 5.9% reported having been diagnosed with attention deficit hyperactive disorder in their lifetime and another 6.6% screened positive for attention deficit hyperactive disorder. This is not surprising because some of the most persistent consequences of traumatic brain injury include attention deficit hyperactive disorder-like symptoms, such as memory and attention impairment, deficits in executive functions such as planning and organization, processing consonants and vowels, and impulsive behavior. Recent clinical studies have suggested a relationship between attention deficit hyperactive disorder and traumatic brain injury that were experienced in childhood. Studies suggest that traumatic brain injury may lead to psychoneurological changes that facilitate attention deficit hyperactive disorder or ADHD, may increase the probability that a person may fall or have another accident that will result in a traumatic brain injury. Adults with traumatic brain injury are more than twice as likely than those without to report symptoms of attention deficit hyperactive disorder. Traumatic brain injuries are increasing. The World Health Organization has predicted that by 2020 traumatic brain injury will become the third largest contributor of disease and disability in the world.